Okay, so here's a little tutorial on how to tape yourself once you receive your tape. Sometimes they are pre-cut, but you'll just need some scissors to make it fit you, because every knee is a little bit different. First step is just kind of take a look at the front of your knee. We want to find the bottom of the hardest part, that kneecap. We're going to find the bottom of that, and then the top of the tibia here. So tibia and inferior pole of the patella. So you're going to find that squishy spot right in between, right? Where you test reflexes and you kick out. So you want that squishy spot. That's where tape is going to go. And if you push in on that squishy spot is what I want the tape to feel like. I want to feel like that tape is pushing into that area. So as we go along, keep that in mind. So I would just kind of measure it out, right? You're not going to need a lot because this does stretch. So I would just cut yourself a piece that's going to not go into the creases behind your knee. So it'll stop right at the side. And then what you'll do is you're gonna cut two pieces at that length. So I'm just guesstimating here, right? So I just cut one piece, but I'm gonna turn it into two. One of the tricks to avoid it rolling up is to round the edges. So I just round here, and I round here. Okay, so I have two pieces. They're a little round and kind of measured to what the length of my knee is. You will take the back of it and you are going to break the tape in the middle. Okay, so this is the way that I apply it. So you have two halves. What you're gonna do is you're gonna lay it down right on that squishy part, right in between those 2 points, okay? You're gonna rub it in right there so that it sticks, okay? And we have these two little wingies hanging off. You're gonna grab the two ends. You're gonna pull it as tight as you can, pushing into that knee, like that squishy area, and then you're gonna lay it down. So we just have a little bit of tension kind of pulling against the front, and then it's heat activated. All these tapes are heat activated, so if you feel like it's rolling up, just add a little friction. It'll make the glue stick again. So do that. And then the second one is just the same thing. It's just a reinforced piece. So again, splitting it in half. And then if you notice maybe on the first one you went a little high or the first one you went a little low, just go in that opposite space. So for that one, I did go a little bit higher. So the second one, I'm just gonna overlap it, but I'm just gonna offset it ever so slightly. So we got that, and you're gonna pull tight, scooping kind of like up. I got a little wrinkle, and that's fine. Wrinkles don't matter. And then I'm just gonna rub it down again. And there you go. So after you have the tape applied, walk around. You should feel like an upward pressure on the knee, and you might get some knee wrinkles. That's very normal. But again, we're taking load off of the tendon itself, putting it back onto the top and the bottom where it attaches at the bone, so that that kneecap or that patellar tendon has time to relax, okay?